Hi, I'm Matt from Pure Pet Food. At Pure, we make a range of natural, air-dried, freeze-dried dog and cat foods, and we're passionate about all things pet health. As we get asked a number of questions about all sorts of ailments and intolerances, we've decided to produce a video series to answer those very questions. And today, we're going to be talking about pancreatitis. We've got Andy the vet who's come in to answer all questions around this topic for you. So Andy, you okay just to introduce yourself for us?
Yeah, sure. So I am a small animal first opinion vet. I've been working across Yorkshire for the past 10 years since I graduated, and I see mainly dogs and cats, and nutrition forms a large part of that work.
So what we'd like to cover today is one of the main topics that we actually get asked about is pancreatitis and how that relates to diet. What I thought would be good is just to go into a little bit more about pancreatitis, a little bit about what it is, and then go into some of the symptoms and some of the things people can watch out for in their dogs. So first of all, could you just give us a bit of an overview of kind of what pancreatitis is and actually how it's caused?
Yeah, sure. So pancreatitis is a condition that affects the organ, the pancreas. So the pancreas is responsible for producing enzymes which break down food once it's ingested and allows the intestines to then absorb the nutrients. And it's specifically involved in breaking down fats, so fatty foods as well. Pancreatitis is when the pancreas will get inflamed and swollen and can often lead to some pain and various other symptoms as well.
And if I was an owner and I had a dog who I suspected could have something wrong with him, what would be the key things I'd probably see if my dog potentially had pancreatitis?
Yeah, so pancreatitis can be a little bit tricky to diagnose, but mainly because it gives some sort of vague symptoms. But some of the few things that owners will notice at home is sometimes their dogs will be a bit more lethargic than normal. They might be off their food, so lose their appetite. They might show some abdominal pain, so seem a bit restless, unable to get sort of settled. Sometimes they adopt what we call the prayer position, where they'll lean forward on their front legs with their back legs stood firmly. And then occasionally they'll have some vomiting and diarrhoea. So they're the sort of symptoms that you'd see, which would prompt owners then to take their dog to the vet.
And one of the things we sometimes find is when people get in touch with us, they'll actually label it as either acute or chronic pancreatitis. And what are the key differences between those two?
Yeah, so acute and chronic basically refers to the timeline. So acute is a sudden onset of the condition, and it tends to be a bit more severe, whereas chronic is a more long-standing condition where it gradually sort of appears. And again, that can be quite tricky to sort of appreciate until it's diagnosed.
And what would you give advice to an owner who has a dog with pancreatitis? I'm sure there's some medical things that they'll have to follow and probably some things that they have to take, but is there any kind of lifestyle changes that they can make?
Yeah, so I think it's one of these conditions where you must take your dog to the vet. One, to be able to get a diagnosis, because these symptoms are quite common in a wide variety of different conditions. Really, it does take some investigations to try and get to a diagnosis of pancreatitis. But once that's confirmed, then treatment will need to be started. So we quite often use some pain relief, some medications that will stop the dog feeling sick. Sometimes we use some anti-inflammatories. Occasionally, in the more severe cases, the acute cases, then they'll need to stay in the practice on an intravenous drip as well. And so once the initial condition has been treated, then we'll discharge the dog and we'll send them home on some long-standing treatment to try and minimise the risk of it recurring. One of which is to feed a low-fat diet. As we said before, the pancreas is really important in allowing the dog and the intestine to digest fat. And so the more fat they have to do, the more fat they have to digest, the more work the pancreas has to do. And so if we reduce that fat in their diet, then hopefully we can just settle the pancreas and reduce the risk of these flares.
Perfect. And is there anything, before we wrap this up, that you think that we've not covered that people might want to do?
Yeah,
to ask?
Yeah, I think with most conditions in dogs, some breeds are more predisposed to this condition than others. So the classic breeds that are predisposed to things like Cocker Spaniels, miniature Schnauzers, Dachshunds, Poodles seem to be risk. Once a dog has had this condition, then they're more likely to get it again, which again is why we recommend sort of some lifestyle changes. And for some reason as well, sort of overweight female dogs are more at risk of that. But in the vast majority of cases, the prognosis is good. In some cases, unfortunately, it can be quite severe and can be quite serious. But like I say, in the majority of cases, the prognosis is good and hopefully they'll make a full recovery.
Perfect. Well, thank you for your time, Andy.
Thank you.
And if anyone has any further questions, they can either comment in the comment section below, or they can get in touch with us, and we can always get in touch with Andy, and we'll be able to answer your questions in a pretty quick, pretty speedy time. Thanks, everyone.